My name is Lilia Burns. I'm the Assistant Executive Director of Hamilton-Madison House for the Behavioral Health Division. Our mental health clinics have been servicing the Pan-Asian community. We have the pros team. We also have 20 plus in the outpatient mental health clinic. As a division, I would say we're continuing to grow.
We've experienced an increase in number of tragic events in the course of treating folks, right? Either folks getting hospitalized, suicide attempts, overdoses. I think all of those numbers have been pretty dramatically up, fivefold, tenfold up in the last, say, a year and a half or 2 years in the pandemic. And the last, I would say, 6 months or so, our caseloads have really increased to the point where for some weeks out of the month, we do have to close intakes. That's absolutely number one priority for us, but I think that speaks to the rising number of phone calls and demand.
The stress of the pandemic, we've been in this constant state of being under threat, right? Which is a lot of stress hormones that are being released in your body. We believe in universal access to care. That's why New York City Health+Hospitals' mission, the most important words are without exception.
So the first step is often the hardest, but it's also the first step to think about it towards wellness. Speaking to your primary care provider, if you feel it's an easy thing for you to do, then by all means approach the provider and talk to them about your issues. But at MetroPlusHealth, we also know that members can seek other resources. For example, they can go to MetroPlusHealth virtual visit and access a mental health professional through telemedicine, and that's available 24/7. For any urgent or emotional behavioral health issues you're having. You can also call MetroPlusHealth as a member to speak to someone 24/7 if you're in crisis. Of course, if at any point you feel like you're going to be damaging yourself or hurting yourself or others, you should always call 911.